the incredible truth about Alzheimer's that doctors don't tell. Have you ever wondered what it would be like to forget the names of the people you love, or not remembering where you are, even if you are inside your own home? What if suddenly your memory began to fade little by little without you being able to help it? Alzheimer's disease is one of the most devastating challenges in modern medicine. It not only steals memories, but also compromises the autonomy, identity, and quality of life of those who face it. The impact of this disease is not limited to the patient. It affects the whole family, transforming the routine and requiring constant care. Alzheimer's was discovered in 1908 by a German doctor, and since then, it has been one of the greatest mysteries in neurology. Conventional treatments try to slow the progression of the disease, but do they really work? Or are there other ways to preserve memory and even reverse the damage caused by Alzheimer's? Today, we're going to explore surprising findings that are changing the way we understand this disease. Real stories, groundbreaking research, and methods that can make a difference to your brain health. Let's get started. Is traditional Alzheimer's treatment failing? Understand the challenges. The diagnosis of Alzheimer's is usually accompanied by a harsh reality. There is no definitive cure. Traditional medicine offers medications to try to slow the progression of the disease, but the results are not always satisfactory. Among the most common treatments are acetylcholinesterase inhibitors such as donepezil, rivastigmine, and galantamine. These medications temporarily increase levels of acetylcholine in the brain, a neurotransmitter essential for memory and cognition. However, they do not prevent the degeneration of neurons or reverse the damage caused by the disease. In addition, the side effects can be severe. Many patients report nausea, vomiting, dizziness, loss of appetite, and insomnia. In some cases, the drugs end up harming more than helping, reducing the quality of life of patients. Another widely used drug is memantine, which acts on a different mechanism, regulating glutamate in the brain. Despite its promise to stabilize symptoms, results are still limited. The great frustration of conventional medicine is that Alzheimer's continues to progress. Regardless of the treatment, most patients experience ongoing cognitive decline, leading to loss of independence and the ability to perform basic tasks. This generates a huge emotional and financial impact for families who have to bear the costs of caregivers, adaptations in the home environment, and constant medical monitoring. But are we looking at the disease in the wrong way? What if, instead of just treating the symptoms, we could act directly on the causes of Alzheimer's? In recent years, researchers have been exploring alternative approaches that go beyond traditional medicine. New evidence suggests that changes in lifestyle, diet, and natural therapies can have a significant impact on disease progression. There are even documented cases of symptom reversal in early stages. If conventional treatments aren't enough, what other options really work? Let's explore some surprising findings below. Why are women at higher risk of developing Alzheimer's? The numbers leave no doubt. Women are 4 times more likely to develop Alzheimer's than men. But why does this happen? One of the most evident factors is longevity. On average, women live about 8.5 years longer than men. As advanced age is the biggest risk factor for Alzheimer's, this already naturally increases the prevalence of the disease among them. But this is not the only explanation. The female hormonal system is another crucial point. Throughout life, women go through intense hormonal fluctuations. Menstruation, pregnancy, and especially menopause directly affect the brain. Estrogen, one of the most important hormones for the female body, plays an essential role in protecting neurons. It helps maintain communication between brain cells, reducing inflammation and stimulating the growth of new neural connections. However, when menopause arrives, estrogen levels plummet dramatically. This abrupt drop can leave the brain more vulnerable to the accumulation of beta amyloid and tau proteins, which are directly linked to the development of Alzheimer's. Another important point is the impact of stress and emotional responsibilities. Women in many societies are usually the main caregivers of the family. They accumulate functions, reconciling work, children, home, and often the care of their own elderly parents. This chronic stress can lead to inflammation in the brain, impairing memory and accelerating cognitive decline. The good news is that understanding these factors allows women to take preventive measures sooner. Studies indicate that healthy habits, such as physical exercise, a balanced diet, and stress control, can offset part of these risks. In addition, hormonal therapies can be evaluated with medical follow-up to minimize the impacts of menopause on the brain. But are there real cases of people who have managed to reverse the symptoms of Alzheimer's? The answer may lie in the surprising story of Dr. Mary Newport and her discovery about coconut oil. The secret that a doctor discovered to help her husband with Alzheimer's. Imagine seeing the person you love losing the ability to remember where they are, forgetting their name, and no longer being able to perform simple everyday tasks. That's exactly what happened to Dr. Mary Newport when her husband Steve was diagnosed with Alzheimer's. Steve has always been an active, organized man and responsible for the finances of the house. However, over the years, he began to have difficulties doing simple math. The clinic's accounting no longer closed, and he began to forget important appointments. The scariest moment was when he went out to a familiar place and couldn't find his way back home. When she took him to the neurologist, the diagnosis came: Alzheimer's at an early stage. Dr. Mary Newport, not accepting the idea that there was nothing else to be done, decided to research alternative treatments. That's how she found a study on coconut oil. Initially, she thought it was a great absurdity. After all, how could a simple oil help in such a complex disease? But the more she researched, the more evidence she found about the benefits of medium-chain triglycerides present in coconut oil for brain health. She decided to give it a try. She started giving 3 tablespoons of coconut oil a day to Steve. Within a few weeks, he showed significant improvements. He went back to driving, remembering appointments, and even managed to shop alone again. It seemed unbelievable. This impressive result made Dr. Newport delve even deeper into this subject. She went on to study the effects of ketone bodies on the brain in depth and wrote a book detailing her experience and findings. Today, his research is a reference for many people who seek alternatives to deal with Alzheimer's. But she wasn't the only one to get amazing results. Another doctor, Dr. Dale Bredesen, has revolutionized the treatment of Alzheimer's with a method that promises not only to slow the disease, but to reverse it. The revolutionary method that promises to reverse Alzheimer's. For decades, it was believed that Alzheimer's was a sentence of no return. Conventional treatments only delayed symptoms without offering a definitive solution. But Dr. Dale Bredesen, a renowned neurologist, began to question this idea. And his studies led him to a stunning discovery. Alzheimer's disease can be reversed in many cases. Dale Bredesen has spent years studying the brain and the mechanisms that lead to neurodegeneration. He realized that Alzheimer's is not caused by a single factor, but rather by a combination of problems that affect the brain over time. Chronic inflammation, nutrient deficiency, insulin resistance, exposure to toxins, and lack of cognitive stimulation are some of the elements that contribute to the development of the disease. Based on this, he developed an innovative protocol called RECODE. This method is not based on a single miracle remedy, but rather on a complete approach to restoring brain health. The protocol includes changes in diet, supplementation, physical exercise, cognitive stimuli, and stress control. The results were surprising. In his studies, more than 100 patients diagnosed with Alzheimer's managed to reverse the symptoms significantly. Many have regained their memory, independence, and returned to a normal life. The impact was so great that he decided to share his findings in the book, The End of Alzheimer's, which became a worldwide bestseller. The work presents the strategies he used to achieve these results and has already helped thousands of people around the world. But is it really possible to prevent Alzheimer's before the first symptoms appear? If so, what can we do today to reduce the risks and protect our memory? How to prevent Alzheimer's before it's too late? What if there was a way to prevent Alzheimer's before it even started to manifest itself? In recent years, several studies have shown that prevention can be the key to keeping the brain healthy and drastically reducing the risk of the disease. The first step towards prevention is to understand that Alzheimer's does not appear overnight. It develops quietly over decades. Small forgetfulness, lapses in attention, and cognitive difficulties can be warning signs long before the diagnosis. One of the main prevention strategies involves keeping the brain active and well-nourished. Research indicates that people who adopt healthy habits throughout their lives have a much lower chance of developing Alzheimer's. And these habits involve everything from diet to stress management and sleep quality. Another crucial factor is insulin resistance. Alzheimer's has been called type 3 diabetes by some experts because it is directly linked to problems in regulating blood sugar. Diets high in sugar, refined carbohydrates, and ultra-processed foods contribute to brain inflammation and accelerate the degeneration of neurons. Therefore, reducing the consumption of these foods can be a powerful strategy in preventing the disease. The practice of physical activities also plays a fundamental role. Regular exercise improves blood circulation in the brain, increases neurotransmitter levels, and reduces the accumulation of amyloid beta and tau proteins, which are associated with Alzheimer's. And we cannot forget the importance of taking care of the mind. Always learning something new, maintaining an active social life, and challenging the brain with activities such as reading, strategic games, and music help strengthen neural connections and can postpone the appearance of symptoms. If preventing Alzheimer's is possible, then what foods can help protect the brain against this disease? The answer may lie in what we put on our plate every day. Foods that can protect your memory and prevent Alzheimer's. Did you know that food can be one of the most powerful weapons against Alzheimer's? Scientific studies show that certain foods have the potential to protect neurons, reduce inflammation, and even stimulate the growth of new brain connections. What you eat today can determine your brain health in the future. One of the most studied dietary patterns in the prevention of Alzheimer's is the Mediterranean diet. It is rich in good fats, antioxidants, and anti-inflammatory compounds, which help keep the brain healthy for longer. Among the most beneficial foods, the following stand out. Fatty fish, such as salmon, sardines, and tuna, rich in omega-3, an essential nutrient for brain function. Extra virgin olive oil, which has potent antioxidants that reduce oxidative stress and inflammation in the brain. Red fruits, such as strawberries, blackberries, and blueberries, which contain flavonoids capable of improving memory and cognition. Walnuts and chestnuts, sources of vitamin E, an essential antioxidant to prevent premature aging of neurons. Dark green vegetables, such as spinach, broccoli, and kale, rich in folic acid, which help keep cognitive function sharp. Turmeric, a spice with anti-inflammatory properties that can help reduce the buildup of beta-amyloid plaques in the brain. On the other hand, some foods can accelerate cognitive decline and increase the risk of Alzheimer's. Among the main villains are refined sugars, ultra-processed foods, fried foods, and excess simple carbohydrates. These foods contribute to insulin resistance in the brain, worsening neurodegeneration. But in addition to food, there is another fundamental factor to keep the mind sharp: brain exercises. Is it possible to strengthen memory in the same way that we strengthen muscles? Science already has this answer. Simple exercises that keep the brain strong and active for longer. Just like the body, the brain also needs exercise to stay healthy and strong. Neuroscience has already proven that constant stimulation of the mind can slow down brain aging and even create new connections between neurons. But what are the best exercises to strengthen memory and cognition? One of the most effective activities is to learn something new. Studies show that challenging the brain with new knowledge stimulates neuroplasticity, which is the brain's ability to reorganize itself and create new connections. This can be done in different ways, such as learning a language, playing a musical instrument, or even testing new recipes in the kitchen. Strategic games are also great allies of memory. Crossword puzzles, chess, puzzles, and logic games force the brain to reason and improve concentration. In addition, cognitive training apps have been developed specifically to exercise the mind and improve skills such as attention, processing speed, and problem solving. Another powerful strategy is the practice of meditation and mindfulness. Chronic stress is one of the great villains of brain health, as it increases inflammation and contributes to cognitive decline. Meditation helps reduce cortisol levels and improves the ability to focus and remember. The brain also needs movement. Physical exercise, in addition to keeping the body healthy, increases blood flow to the brain, and stimulates the production of new nerve cells. Activities such as walking, yoga, and dancing are excellent options for keeping the mind active and preventing Alzheimer's. Finally, maintaining an active social life is essential. Talking to friends, sharing experiences, and having a purpose in life strengthen neural connections and can delay the onset of symptoms of the disease. Now that you know what can be done to protect your memory, comes the big question. What does all this mean for the future? Are we closer to beating Alzheimer's? The answer may lie in how each of us chooses to act from today. Alzheimer's may seem like an implacable enemy, but science has shown that there are ways to prevent, delay, and in some cases even reverse its effects. What was once seen as an inevitable fate is now a challenge that can be met with information, healthy choices, and new medical approaches. If you have a family member or loved one going through this journey, know that there is still hope. Small lifestyle changes can make a big difference. Taking care of your diet, exercising your brain, keeping your body active, and reducing stress are attitudes that can preserve memory and quality of life for many years. And more than that, never underestimate the power of human connection. Love, affection, and patience are as important as any medical treatment. Science advances every day, bringing new possibilities and renewing hope that, in the future, Alzheimer's may be something of the past. What can you do today to protect your mind and that of the people you love? The answer is in your hands.